Welcome to the very first mini lecture of HTL 320, Anatomical Pathology 1. Over the next several minutes, I want you to answer a question that sounds simple, but really isn't. What is anatomical pathology? Before we ever pick up an instrument or orient a specimen, we need to understand the field we're standing in and where your work fits inside it. This lecture pairs with your reading in Leicester, the general approach to specimens, and the section on the surgical pathology report. So as I talk, connect what I'm describing back to what you read this week. By the end, you'll understand what anatomical pathology is, how it differs from the other half of laboratory medicine, and why the histotechnician at the grossing bench is central to an accurate diagnosis. So, let's get started. Let's start at the root. Pathology is the scientific study of disease, its causes, its mechanisms, and the effects it has on the body. So far in your training, you've learned a great deal of normal anatomy, normal physiology, normal histology. Pathology is where the knowledge turns towards what happens when things go wrong. It sits as a bridge between the basic sciences and clinical medicine. The physician treating the patient depends on the pathologist to say what they're actually treating. That's the question at the center of the whole field. What exactly is wrong with this patient? Now, pathology divides into two great branches, and it's worth being clear about the difference, because this course lives firmly in one of them. Those branches are clinical pathology and anatomical pathology, and that's what we'll look at next. Here are the two branches side by side. On the left, clinical pathology, the world of blood tests, cultures, and fluid analysis. When a physician orders a complete blood count, a glucose level, or a blood culture, that work happens in clinical pathology, and the results come back largely as numbers and values. It's a huge and vital part of laboratory medicine. On the right is anatomical pathology, and this is our home for the next 16 weeks. Anatomical pathology makes its diagnoses by examining tissues and cells directly. First, grossly, meaning with the naked eye at the bench, and then microscopically, under the scope. The deliverable isn't a number. It's an interpretation of what the tissue shows. Notice the fundamental difference. Clinical pathology measures, anatomical pathology observes and interprets. Both are essential, but yours is the second. Anatomical pathology itself contains several subspecialties, and knowing them helps you see where you'll spend your career. The biggest by far is surgical pathology. Any tissue removed in an operation or taken as a biopsy comes here to be examined and diagnosed. That's the bulk of the daily work in most labs, and it's the primary focus of this course. Cytopathology deals with individual cells rather than intact tissue. The classic example is the Pap test, along with fine needle aspirates. Autopsy pathology is the examination of the body after death to understand disease and cause of death. And forensic pathology does that same post-mortem work in a legal or medico-legal context, where findings may end up in court. We'll touch autopsy and forensic pathology later in the term, but keep surgical pathology front of mind. That's where the specimens you'll prepare come from. Now here's why this field carries so much weight. For an enormous range of conditions, the pathology report is not one opinion among many. It is the definitive diagnosis, the final word. When a patient has a mass, the question of whether it's cancer or benign, and if it's cancer, exactly what kind, is answered by pathology. And that answer drives everything downstream, whether the patient needs chemotherapy, more surgery, radiation, or simply reassurance and follow-up. The oncologist can't build a treatment plan, and the surgeon can't decide whether to go back and take more tissue until the pathology report exists. This is the reading's core message about the surgical pathology report. It's the endpoint of the whole process and the document the entire care team relies on. So when we practice writing an accurate gross description, remember, it feeds directly into this consequential report. You'll sometimes hear pathologists called the doctor's doctor, and it's a phrase worth sitting with. It means other physicians, such as the surgeons, the oncologists, the internists. They depend on pathologists to tell them what they're dealing with. The pathologist's diagnosis guides their colleagues' decisions. And here's the striking part. Most patients never meet the pathologist who diagnosed them. The work happens behind the scenes, away from the bedside, and yet that quiet interpretation directs the entire course of a person's care. I raise this not just as professional culture, but because it tells you something about your own role. You will also work behind the scenes, and the quality of your work will shape outcomes for patients you never met. That's a serious responsibility, and it's part of what makes this profession so meaningful. Now, let's connect all of this back to the bench, because everything I've described depends on one physical thing, a piece of tissue that someone has to handle correctly. A diagnosis is only as good as the specimen it's made from. That specimen has to be received properly, described accurately, sampled thoughtfully, and processed well. And if any of that upstream work is done poorly, the diagnosis is compromised, no matter how brilliant the pathologist is. Let me say it plainly, and it's here on the slide. A perfect microscope cannot rescue a specimen that was mishandled at the bench. This is exactly why your Leicester reading opens with what it calls the general approach to the specimen, a disciplined, repeatable method for handling whatever comes across your table. That approach isn't bureaucracy. It's the thing that protects the diagnosis. We'll practice the first pieces of it, orientation and measurement, in this week's lab. And that brings us to you. The histotechnician and histotechnologist are central to making the diagnosis possible. You are the person who prepares the tissue that becomes the slide the pathologist ultimately reads. Every well-oriented specimen, every accurate measurement, every properly processed section is a link in the chain that ends in a correct diagnosis. This course exists to build that foundation, to teach you to handle a specimen so precisely and correctly that an accurate diagnosis can be made from it. I want you to carry one idea out of this lecture above all others. Even a task that feels routine to you carries real weight for a real patient on the other end. That mindset, treating every specimen as consequential, is the mark of a professional, and it's what we'll cultivate all term. So let's pull it together. 3 things to carry forward. First, anatomical pathology is diagnosis made from tissue and cells, examined both grossly and microscopically. That's the field you're now training in. Second, the pathology report is frequently the definitive diagnosis, the document the entire care team depends on, which is why the quality of the work behind it matters so much. And third, correct specimen handling is what makes that diagnosis possible. And that handling is your role, the thing this course is built to teach. In the next mini lecture, 1.2, we'll follow a single specimen from the operating room all the way to the signed report, so you can see every step and where your work fits. Before then, finish this week's reading, Leicester pages 2 to 9 and 37 to 41, and Westra chapter 1, and come to lab ready to work. I'll see you there. Thanks.